Hello and welcome to the business of healthcare, powered by ABI Health and CHiME. I'm your host Apurva, and today we are diving into the topics that has become central to the modern healthcare, patient engagement using digital technologies. To explore this, we have someone truly special with us, Dr. Bijoy Johnson, consultant in healthcare data analytics at Baby Memorial Hospital. Dr. Bijoy has been with Baby Memorial Hospital for the past 8 years, driving multiple digital innovation. He has deep-rooted passion for computers, machine learning, and artificial intelligence, and has dedicated his career to harness data and technology to improve patient care. Today he joins us to share his experience, his insights, and his vision for the future of digital patient engagement in India. Dr. Bijoy, welcome to the show.
So thank you very much for having me.
Let's dive right in. Let's start with the basics because patient engagement can mean different things to different people. So Dr. Bijoy, how do you define patient engagement in today's digital healthcare environment, especially within the Indian context?
So patient engagement today is actually about empowering individuals to take an active and informed role in their health. So it's no longer about just providing some information. So that has been going around for a long time. But it's about building a true partnership between the patients and the healthcare providers. So traditionally, healthcare was basically one-sided. That is, the doctor gave an advice and the patient followed the advice. But in today's digital era, this model has shifted. So patients want transparency and they want real-time access to information, and they want to be a part of the decisions about their care. And effective engagement means that we give patients the tools and information so that they can manage their health, they can ask the questions, they can follow the treatment plan and stay involved throughout their journey. So it's not something that starts at the hospital. So it's something which starts at the very beginning. So it continues through the diagnosis, treatment, recovery, and even the long-term follow-up. And engagement is continuous and technology enabled. So whether it is a mobile app, whether it's a patient portal, WhatsApp chatbot, a teleconsultation platform, or even remote monitoring. So this omni-channel approach ensures that patients can interact with the healthcare system at any time. And so for me, patient engagement means moving from patient compliance to patient participation, and from episodic care to a connected care. So when patients are informed, they feel that they're in control, their outcomes are improved, the trust strengthens, and the healthcare experience become more patient-centered. So that's what I think about patient engagement.
Absolutely, like that's a great point. I really appreciate like how you highlighted that patient engagement is not just one-way interaction, and it is like genuinely have become a collaborative experience. And today patients are not just receiving the information, they are able to, make informed decisions about their care. And hospital like yours are giving them the tools to guide the journey confidently. And that's a significant evolution. Building on that, Baby Memorial Hospital has been quite proactive in adopting digital solutions. What technologies are you currently using to improve patient engagement? And could you share some real examples on how they have made a difference?
Right, sure. So whenever we think about doing some digital innovation, so we should take a step back and identify what is the problem that we are trying to solve. So we should not just do innovation for innovation's sake. It should be towards a problem and to find a solution for that. And for something, it might not be even a digital solution. So we can do something which is as simple as changing a paper form or something like that. And that itself can solve a problem. So the first step would be to identify that this is what is the problem, how do we go about solving it, and what is the best solution for that. So we identify the various pain points faced by patients. So one of the main things is uncertainty. So on the uncertainty about waiting time, how to reach a specific place within the hospital, what is the status of my discharge, etc. So understanding this pain points of patients helped us in rethinking our processes and explore how digital tools can be used for bridging the gaps. So one of the first steps was developing our patient information portal. So it acts as a digital front door for our hospital. And through the patient portal, patients can do various things like book an appointment, access lab reports, view the detailed doctor profiles, and so on. And we introduced something like a pre-registration feature. So in which the patient can complete the registration details from their home before coming to the hospital, so that they don't have to stand waiting in the queue. And we also give them access to home care requests, so patients can raise a request for a home care visit, and they can even track the status of the service. So when we order pizza from Domino's, we know that the pizza is being prepared, the person has left on the way, and so on. So similarly for a home care visit, the patient has we send a link to a patient, and patient can see that the home care staff has started from the hospital, is expected to reach their house, and so on. And a couple of other things. We have a hospital directory with information about the various departments. Then we have admission and discharge guidelines, educational booklets, and we also had added a TV channel list. If we go to a hotel, we want to view a specific channel. It's difficult for us because it's all the channel numbers are different, right? So that's something which we created. And also we created a 360-degree virtual room tour. So basically, before the patient selects a room, they can see what the room looks like and make an informed decision. Then we built a WhatsApp chatbot, which helps us access to information. So nowadays everyone uses WhatsApp, so it's a familiar interface, and people don't have to download any other application. So just for booking an appointment, if you want to download a hospital application, then it's a cumbersome process. So we did it through the WhatsApp chatbot. You can see the doctor schedules, get their lab reports. And one interesting use case was the find a UHID feature. So when a person comes to the hospital and they stand in the queue, and the people in the counter, if they don't bring their card or something, the first thing that they'll ask is what's your UHID. So because against the UHID, we have to create an appointment, do a test, and so on. But people don't remember the UHID. What they'll do is they'll give their phone number, then we'll have to search based on the phone number, and so on. So what we did was, for patients, they can just send a message from their registered WhatsApp number saying find UHID and or get my UHID. And to the WhatsApp number, we'll send a message saying that these are the UHIDs registered to their number. So it makes it easier for them to interact with the counter staff. And one of the other use cases practical challenges was about the navigation. So BMH Kozhikode is a 500-bed facility. It is spread across 3 different blocks, and visitors often find it difficult to find their way to a specific location. So we explored various options for indoor navigation system. GPS, as you know, wouldn't work indoors. And there is another technology for using Wi-Fi triangulation, but it would require a patient to install an app, which is again something we wanted to avoid. So what we did was we wanted something which does not require any installation, and people can just start using it. So what we created was a QR code based indoor navigation system. So basically what we did was at various locations in the hospital, we placed a QR code, and when a person scans the QR code, they are taken to a link which opens a web page. And based on the QR code, we know that the person is scanning the QR code from a specific location, let's say A block, ground floor. And from there, the person will select where they want to go. So for example, they want to go to a CT scan. So the application will say that, you are currently in A block ground floor, the CT scan might be in the basement of C block. And this is the step to go from, so go there, turn right and reach the CT scan. So that is some easy way to navigate to a specific destination that we created. And if at all at some point the person finds it difficult to continue, they get lost, they can just scan another QR code on the way, and then they can restart the journey.
Right.
And a couple of other things. So we have the digital queue management system. So we know the real-time status of the queues. Then another initiative was during the discharge time. Discharge time is everyone wants to go home as soon as possible. And in the morning, the doctor comes around and the patient is informed that they are cleared for discharge. And the families, they are naturally eager and they keep approaching the nursing staff for updates. So is the discharge summary ready? Is the bill ready? And so on. So what we did was, as soon as the discharge is intimated in the system, a message will be sent to the patient's phone saying that this is the discharge status, and you can click on this link to view the real-time status of their status. So for example, they will know that this is patient, so currently discharge summary is prepared, bill is prepared, and so on. So that's also something that we did. And then we did a labor room notification system. So basically, family members are waiting outside the labor room, and they would like to know what is the status of the mother. So similar to the discharge tracker, we created a system where once a mother gets admitted in the labor room, a message with the link is sent to the registered number, and the nursing team periodically give updates so that the family outside can view the mother's progress. So we have created a couple of different tools like chatbots, navigation system, discharge tracking, digital feedback. So all of them help in creating a human-centered and digital care experience.
And that is really interesting innovations that you have done, especially the in-house navigation system. How has this changed the patient experience on ground? Are you seeing any fewer direction related queries, or is there any smoother movement inside the hospital?
Right, definitely. So previously what used to happen is people would have to go around asking the staff, so how do I go to this place, where is B block, where is C block, and so on. So now people can use the digital solution, and definitely we can promote it so that more and more people use the solution to get navigations within the hospital.
Okay, that's really interesting. It's great, to hear how solutions translate into actual outcomes for the patients
Right.
and also to the hospitals. It becomes really helpful. So, building on what you just shared, what digital tools or trends in patient engagement do you find most promising for the next 5 years?
Right. So we're actually seeing incredible innovation across healthcare. So one of the tools, important ones would be wearables and remote monitoring devices. So they are becoming more and more sophisticated. We have heard stories about how an Apple Watch saved the life of a person because they went into cardiac arrest and they automatically notified the care provider so that they could get an ambulance and so on. So these devices help in collecting the patient status from their home while they are at work, so they can monitor various things like heart rate, activity, sleep. So the shift will change from an episodic hospital visit to a continuous care paradigm. Another example would be the use of AI and data analytics. So there will be especially when we talk about monitoring devices, there are a lot of data that is coming in. So if we are monitoring the heart rate, there is a continuous stream of data about the heart rate. So we would require the help of some AI or data analytics solutions to help in the analysis. And this will help in predicting the risk factors, supporting the treatment planning, and even tailoring the communication. So let's say that certain people want to have their communication in a specific language. So we can based on. Or if you want to do based on the literacy of the person. So if you want to make a simple communication, if you want to more in-depth communication, so all of that is possible with AI-driven customization. So next would be mobile apps and patient portals. So this is something which helps in interoperability, especially thanks to frameworks like the AYUSHMAN Bharat digital machine. And patients can access their health records, appointment reports, and engage with the team in a healthcare team in a unified way. Then we can also enhance the in-hospital digital experiences. So for example, earlier we talked about the in-hospital navigation system. So not only outside the hospital, within the hospital also we can evolve and do better in terms of the digital solutions that help in making the patient more comfortable with their hospital visit. So I think all these tools will help in moving from a reactive patient care to a more preventive and continuous engagement in terms of healthcare experience.
That's fascinating. Like, you have painted a very clear picture of where the industry is moving. And speaking of movement, how is the integration of AI, wearables, and remote monitoring changing the relationship between the clinicians and the patients?
Right. So the integration of AI and remote monitoring is transforming the relationship between patients. So it's shifting from something which is reactive and hospital-centric to a proactive, continuous, and collaborative one. So traditionally, interactions happen only during the time of appointment or when a person comes to the hospital. But with real-time data monitoring, so the patient can be having, let's say, wearing a wearable, and from their home, the continuous monitoring is happening, and the clinicians can look at the dashboard and see whether how the patient is progressing, whether the patient has taken their medication, and so on. So let's say we give a patient some anti-hypertensive medicine, but the follow-up happened, let's say, after 1 month. So only after 1 month, the patient, the doctor would know what is the status of the person, whether there is a hypertension, blood pressure is in control, and so on. But with continuous monitoring, what we can do is the patient can do a monitoring at home. They can upload it into the application, and so that the clinician sitting in the hospital can monitor the progress of the patient, and they can even adjust the medication appropriately. So that's something which helps in more personalized treatment and helps in preventing complications before they escalate. And again, when it comes to wearables, as I said before, AI is going to help in making sense of large volumes of data, and it can help in identifying patterns, predict risk, and it can alert clinicians to early warning signs. So this will help us in a faster response to complications. And then, in terms of safety and beyond improving the safety and outcomes, it is actually also help in strengthening the relationship between clinicians and patients. So currently, if a clinician has to see a patient, they have to see the patient, then write the notes. Then they have to spend a lot of time looking at a computer screen to ensure that all the EMR data is filled up properly. But with the use of technologies like an ambient EMR, so ambient EMR is something which listens to the conversation between a doctor and a patient, and it will make a structured data about what is the interventions being planned, what is the medication being advised, what is the history of the patient. So all of this without requiring the doctor to go and type it in the computer. So this will help the doctor to spend more time face to face with the patient rather than looking at a computer screen. So that is something which can enhance the relationship between the patient and the doctor. So these are the couple of things which will help in how AI and the other related technologies will impact and help improving the clinician-patient relationship.
I mean, that's really interesting and a very powerful shift, as you have mentioned, that now the tools are not just reactive, they have become proactive and they're slowly becoming companions in care rather than just systems. And I really like how you mentioned earlier in the conversation that, ABDM is creating much stronger digital foundation across India. And it's interesting to see how digital tools are slowly becoming companions in care rather than just systems. So how do initiatives like ABDM impact patient engagement at the hospital levels? Are you already seeing the influence of these national frameworks in your day-to-day workflow?
So national health initiatives like ABDM will have a transformative impact on patient engagement. So one of the biggest barriers in the healthcare system has been the fragmentation of patient information. So let's say at the time of birth they will be in one hospital. As a kid, they'll be seeing doctors in, let's say, another hospital, and as an adult, they might move to another city and they might be visiting another hospital. So all this clinical history is a very important part of healthcare. So only if a doctor gets access to the full clinical history can he make the most informed decisions. So it is right now it is expected that the patient would carry all their previous records to each of these hospitals, but with the introduction of systems like ABDM, it will help in addressing this challenge by creating a unified healthcare digital ecosystem. So patients can have a unique, secure identity through which the medical records can be accessed with their consent. So that consent part is also important because not anyone can't, because it's a very sensitive information. Only with the patient consent can a healthcare provider access the data. And this helps in interoperability. So if today I want to go and see another hospital and the doctor, so I can easily use the ABDM platform. The data, my healthcare data and my health history can seamlessly travel across the hospitals, labs, and various healthcare providers. So by setting these national level standards for data exchange, it helps in digital adoption and reduces the fragmentation in the healthcare ecosystem.
I mean, that makes perfect sense. The national push really does create, new possibilities locally. Now let's talk about the other side of the innovation, the challenges. You have been at the forefront of digital programs for years, and you had mentioned to me earlier while we were having a conversation that after COVID, the acceptance of digital initiative has gone up significantly, both from the patient and hospital staff. That's such an important shift because adoption is really half the battle. But even with this improved acceptance, what are the biggest challenges hospitals still face when adopting technologies? And how do you navigate these issues like digital literacy, data privacy, or resistance that still exist despite all these progress?
Right. So one of the biggest challenges is the wide diversity in the patient background. So some of them are good with technology, some of them are not comfortable with that. There are people from various languages. They have different expectations how healthcare should be delivered. So catering to all these different type of patients is a challenge. So especially from a person is coming from a rural area and asking them if we ask them to use the kiosk to do an appointment, so it will be very challenging for them. And from the hospital perspective, when we are introducing new digital tools, it should be in line with the existing hospital systems. So if you try to do something which is totally different from existing hospital workflow, there will be a resistance and it will be difficult to get it implemented. And so adoption fails when digital tools are introduced, but without understanding the ground level realities. And also data privacy and security are also major concerns because healthcare data is very sensitive. And recently we have the DPDP Act and the DPDP rules being published. And also it's a responsibility of the healthcare provider to ensure that the systems are secure, compliant and trustworthy. And patients should feel confident that their information is being handled securely. So to address these various challenges, the important aspect is thoughtful design and gradual adoption. So when we at BMS, when we create solutions, we try to go, like it said that well begun is half done. And we try to do a proper planning before we start implementing any of the new digital solutions. And in one of the previous questions, I mentioned that we went through a process of what are the various pain points that the patient is experiencing before we try to come up with some digital solutions. So coming to solutions addressing these challenges, so one example would be to use solutions which are easy for the patients. So that's why we chose WhatsApp for many interactions, because it's familiar to most people and it helps in eliminating the barrier of learning to use a new application. And our staff would always help the patients in using the digital tools. So for example, we have self-service kiosks, but we have also a person which is standing near the kiosk so that if at all some person requires some assistance in using a specific solution, they help the patient in completing that transaction. So whether it is searching for some information or for booking an appointment. So all of them, we have a person which will help them in completing the transaction. So it provides an additional, the human guidance has been critical in building trust and ensuring a smooth adoption. Also, we have to involve all the hospital staff. So clinicians, nurses, administrative staff, we have to involve them early in the transformation process. So when they see that the technology is something which is helping them do their work better, they will become champions rather than critics. So that is so feedback-driven design is something we have strive to do when we do new digital innovations. And from a security standpoint, so we use a secure cloud infrastructure, strict role access control, encryption, continuous security testing, and audit. So all this will ensure that the health information is kept secure and accessible only to authorized users. So basically, the idea is we should not force digital adoption. We should make it the most convenient and natural option. So a simple example is the difference between a person standing in the queue for getting an appointment versus a person going to a self-service kiosk and getting it done within a couple of minutes. So once we make it the most convenient option, people will naturally go for the digital adoption.
And that's very true, and it's very reassuring to hear how thoughtfully you approach these challenges. And it brings something, it brings me something to equally very important. Even as the technology grows, how do you ensure that human-centered care doesn't get lost in the process?
Right. So human-centered care actually becomes more important as digital health and AI continue to accelerate. So technology should be only to support efficiency and access to care, but it cannot replace the emotional connection or the empathy and the trust. So these are the things that define healthcare. So when I was in medical school, there would be, I have heard anecdotes that patients would talk to a doctor for a long time, and after that they'll say that just because they could have a good conversation with the doctor, they had their symptoms were feeling better. So that's something which is a cornerstone of healthcare. So we can never eliminate the human touch. And so patients don't just come to hospitals for treatment. They come for reassurance, understanding, hope. And all of these require a human presence. So digital tools should focus on handling the background tasks like documentation, coordination, reminder, scheduling, and monitoring. And when technology takes care of these repetitive tasks, so clinicians they get more time to spend with patients. They can listen to their patients rather than doing some documentation, and it will help in achieving better outcomes. So it's so compassionate handhold and encouraging word, a moment to explain something. So all of these can be done only by a human. So AI can be, for example, used to predict deterioration, but you can't say we cannot comfort a family which is waiting outside an ICU. And it can help in delivering some instructions, but it cannot help someone in understanding what's the problem. So basically, the future would be it should be a technology enabled but human led empathetic care. And so this combination would help us in compassionate, connected, and high quality care delivery to patients.
And absolutely. I mean, the balance is very crucial, and technology should support empathy rather than replace it. So, let's
Right.
move to the next topic. You have
Right.
implemented many digital tools over the years. Have you seen any measurable improvements in patient satisfaction or the outcomes? What metrics do you look at?
Right. So we have definitely seen great improvements in patient satisfaction on overall experience. So when the patient and the families feel informed about what is going to happen next, have access to information, so their level of comfort increases. The tools like digital queue status displays, discharge status updates, the labor room notifications, and use of WhatsApp. So all of them help in creating a smoother healthcare journey. And in terms of measuring success, we have various indicators to measure. That is, we use patient satisfaction surveys, we use the feedback resolution times, we track the adoption of the various digital tools. We look at what's the waiting time reduction, what's the change in the discharge turnaround time, and we also look at the qualitative feedback from the patients. And in addition to this, we also monitor the staff feedback. So if you are doing something which has an impact on patient, and we also ensure that the staff who are using it also feel comfortable about using the application. By using and monitoring all these various metrics, we can progressively monitor them and ensure that it is providing the intended benefit.
I mean, that's very encouraging to hear, and it shows how powerful digital engagement can be when it is done right. Now, before we wrap up, where do you see the future of digital patient engagement heading, especially in emerging markets like India?
So I think the future of engagement is moving towards a model that is personalized, predictive, and continuous rather than just episodic hospital visits. And this is something that happens it will shift from something which happens solely within hospitals to healthcare which is happening continuously at home, at work, in the community. And it will be powered by smart devices, remote monitoring, wearables, and so on. And we have the conversational AI platforms like WhatsApp, then we have the regional language interfaces, then the voice-based systems. So all of them would make healthcare more accessible to people. And the wearables and remote monitoring will help in getting the real-time insights into chronic diseases. And it will help in interventions before issues become emergencies. So preventive care will become a much bigger focus. We'll also see more of hyper-personalized care. So our AI can tailor the treatment plan, provide educational content, and provide reminders for an individual health, lifestyle, and language. For a place like India, which is a very vibrant and diverse culture, so technology has the potential to not just improve healthcare, but to democratize it, and it will make high quality healthcare accessible and affordable to a wider section of the population. And with digital innovation, we can help in building an equitable healthcare landscape.
Beautifully said. Like, that's a perfect note to close on. Dr. Bijoy, thank you for joining and
Thank you so much.
for sharing such thoughtful and practical insights. Your work at Baby Memorial Hospital is a testament on how technology and humanity can come together to improve patient care.
So thank you so much for having me. It was a great pleasure. Thank you.
Yes. And to everyone listening, thank you for tuning in to the Business of Healthcare powered by ABI Health and CHiME. I'm Apurva and I look forward to seeing you in the next episode. Thank you.